AIDS Services Foundation Orange County was founded by a small, dedicated group of community volunteers in 1985 to provide support to their friends and loved ones who were dying of AIDS and in desperate need of help. In the beginning, ASF's primary goal was to help individuals die with dignity. With the recent advent of protease inhibitors and other medications, the agency's mission shifted to preventing the spread of HIV and improving the lives of men, women, and children affected by HIV/AIDS in Orange County. ASF has served almost 75% of the individuals affected by HIV/AIDS in our area, and has evolved into the most comprehensive and experienced nonprofit HIV/AIDS organization in our locale. ASF envisions an Orange County where HIV infections are rare, and when they do occur, we'll work to ensure that every person, regardless of age, gender, sexual orientation, gender identity, residency status, or socioeconomic circumstance, will have unfettered access to high-quality, life-extending care, free of stigma and discrimination. ASF is committed to building strategic healthcare partnerships and expanding prevention and education. We need to communicate that HIV/AIDS is not yet cured and that our mission is still relevant. To accomplish these goals and improve operational excellence, ASF needs continued financial support from individuals, foundations, and corporate partners. ASF is successful because of our reputation in the community as the leader in the care of people living with HIV. We completely understand the needs of our clients. Because of our reputation, we are uniquely positioned and have the necessary resources to act as leading collaborators in new HIV/AIDS initiatives. ASF attracts and cultivates staff members who lead their peers in the care of people living with HIV. Members of our board and advisory board have been involved in the fight against HIV since the early days of the disease and are pioneers and leaders in AIDS advocacy. ASF has greatly expanded our HIV testing presence in the community and is testing in the places where Orange County's high-risk populations congregate. We're seeking out the people who are most at risk for acquiring HIV instead of waiting for them to come to us. We're also reaching out more to our youth to educate them about the realities of being HIV positive and how they can protect themselves. Right now, our best defense against HIV is testing and prevention education. ASF offers high-quality, life-extending care to people in Orange County affected by HIV/AIDS, free of stigma and discrimination. To make sure we're doing this, internal audits are conducted throughout the year to assure agency-wide consistency and program procedure adherence. Client satisfaction is monitored using an annual client survey, and the program committee reviews and assesses our monitoring and evaluation efforts on an annual basis. Most people in Orange County are unaware of the number of comprehensive services for people infected with HIV housed under one roof at ASF. Our case management system allows clients access to transportation to and from medical appointments, nutritious meals provided through our food pantry, mental health services, housing assistance and life skills, programs for families and children, and prevention education. The money we raise funds these programs that are aimed at returning our clients to self-sufficiency. On an annual basis, ASF provides critically needed services to approximately 1,600 individuals living with HIV. This includes case management services which help clients remain in medical care. Along with this, over 2,500 HIV tests are administered to individuals in the community. ASF has many success stories. Maria, an HIV-positive woman in her early 30s whose husband recently died of AIDS, has joined our Spanish Women's Support Group. For years, she kept their diagnosis a secret from family and friends who thought that her husband died from cancer. In the group, she has met other women who are also widows and have had to keep the diagnosis to themselves. She's comforted by these women who have taken her under their wing and know exactly what she's going through. Maria is now strong enough to talk to others about HIV and the myths surrounding the disease. Historically, ASF has faced the challenge of the stigma associated with HIV/AIDS. Early in our existence, the agency lost its lease when the landlord discovered we were working with people with AIDS. While extreme bias like that is now rare, the stigma of AIDS still remains and makes the agency vulnerable. This stigma affects our ability to attract a full range of donors to support our cause. We are addressing the challenge by reaching out to new communities of donors to educate them about the plight of people living with HIV/AIDS. With additional resources, ASF could further expand our testing program to reach even deeper and more often into high-risk communities. We've seen increased acceptance to testing when we're out in the community. The agency could also expand marketing efforts to inform the general public and targeted at-risk communities about HIV/AIDS in Orange County. ASF can spark dialogue about HIV, safer sex, and risk factors, and we're certain we'll see a decrease in the incidence of HIV among our youth and Latino populations. ASF is in the process of identifying needs in the community that we can address and that will advance our primary mission. We're already addressing a problem that tends to occur concurrently with HIV infection by offering testing for hepatitis C. ASF hopes to expand further on this trend by offering testing for other sexually transmitted infections. The hope is that individuals seeking other types of testing may also choose to get an HIV test.